want to just live in your brain sometimes.
No, you don't.
I do.
You don't.
Just on the weekdays, not the weekends. Or vice versa. I don't know.
I don't know.
Whenever you hear individuals talk, like a layperson talk about my child has cerebral palsy, and I feel like people immediately go to something happened with the strip or the monitor. And I feel like those two things have become almost kind of an equal conversation or something. Can you just give us a little bit of like some objective information surrounding that?
Sure.
That's not emotional.
Yeah.
You know?
Cerebral palsy is a subset of a group, something we call neonatal encephalopathy. So there are different types of cerebral palsy. Very few cerebral palsy cases are attributed solely to events during labor. And I think as we get more data, right now the NICHD is doing the Human Placental Project. I think we're going to find that there are a lot of potential genetic factors or other factors. Infection is a big cause for any type of brain damage, including cerebral palsy. But this is the litigation area. So this is an area that is often litigated. One of the things that I think is a mistake is the concept that EFM, even when used appropriately, can prevent all types of brain damage.
Right.
Electronic fetal monitoring is primarily an oxygen monitor. So while it may be helpful in preventing a certain type of brain damage that's due to lack of oxygen, there's other pathways, such as infection, that can cause brain damage.
Yeah.
Again, what's the best scenario? That the clinicians who are caring for women and birthing people understand the limitations of fetal monitoring, the fact that it has no diagnostic value. It cannot tell me when a baby's going to have a bad outcome. At best, it is a screening tool. And this is something that I think everybody needs to understand. What does a screening tool do? A screening tool identifies normal out of a group and pulls it out and says, we don't have to worry about this group of people. The people who fail to screen, some of them will have the problem and some of them won't. That group needs a follow-up test. The problem with fetal monitoring, there is no follow-up test. We've tried a few different things. They haven't seemed to work, or at least they don't seem to work in this country. And that's a real issue, because as long as the fetal monitoring is telling me, hey, everything is good, if you will, and I can continue labor and not worry about the baby's oxygenation during labor, fine. But when it's unable to tell me that, how do I then determine whether it's safe to continue labor or whether we should deliver the baby? And that's why these algorithms, one of which that has actually shown cause and effect, in other words, is the level of evidence that we can draw some conclusion that these are important, but not everybody knows about them.
Yeah.
And not everybody understands that fetal monitoring, electronic fetal monitoring, has no diagnostic capability. We keep trying to make it a diagnostic tool. It's not.
That's
a screening
true.
tool.
And what algorithms, or where is the best place to look and see these algorithms?
Well, the model that David and I use is called the Miller model, and that's in our textbooks, but it's also in other textbooks. It was published as part of the Patient Safety Series in the Grade Journal. And then the delivery management algorithm for physicians and midwives and nurses to talk about is known as the Shields algorithm. And that is actually been published, and I think it's the American Journal of Perinatology. Again, I can give you a citation to put in the comments. But that is an algorithm that I have been teaching pretty much since within a year after its publication. I think it was published in 2018.
And patients could get a hold of that article too. It's been long enough to where
they could get a hold of it, but
just,
again, if they're right, it might be hard to understand if you don't have a medical or statistics background. Certainly it's something that you can bring up. What algorithm do you use, if any, in fetal monitoring? More important question, I think, for women and birthing people is, what training have you had in fetal monitoring? And when was the last time you took a class in fetal monitoring? And if they're like, oh, I learned that in residency, and that was 20 years ago, that's not enough.
Yeah.
It's not enough.
No, that's so true. Ooh.
So,
well, I'll put links for your,
Yeah,
you know,
and let me
everything
know.
below,
I'm
because I want to make
happy-
sure people have. 'Cause
Happy to give those.
you go places, but they could also do it online.
The online course is available for clinicians, but it's not as detailed as the advanced
Okay.
course, like what we did when you were there
Sure.
in Las Vegas. So the advanced course is something that I do at hospitals. I am going to be developing some online modules that are like subsets of the day-long course. Those will be available through A1. I have partnered with A1 to make webinars available because I just can't go all over the country. And so we're going to be talking about all these issues, and nurses, midwives, and docs will be able to get these webinars on demand. And
So if they're members of A1, is that right?
you get a discount if you're a member,
Okay.
but even non-members will be able to access them.